Course number 4, Interstate Access to Minnesota PMP Data. Following this session, the viewer will have a better understanding of interstate PMP sharing. When reviewing PMP data, it's critical to have the most complete data possible. This includes controlled substances that may have been dispensed to patients outside of Minnesota. Some Minnesotans spend several months of the year in other states like Florida, Arizona, amongst others. Additionally, there are many individuals that reside in other states that come to Minnesota for health care or receive health care while vacationing in Minnesota. It was recognized by the Minnesota legislature in 2014 that participating in multi-jurisdictional PMP data sharing would allow providers to have a more complete picture of their patients' controlled substance history. In that year, the Board of Pharmacy entered into an agreement with the National Association of Boards of Pharmacies PMP Interconnect Data Sharing Hub. An additional hub was created in 2019 by the Bureau of Justice Assistance. These hubs perform essentially in the same way, and Minnesota participates with both hubs. Interstate PMP hubs act as a delivery system, sending electronic requests for PMP data to different states and jurisdictions. And when credentialing criteria is met, returning a message containing that jurisdiction's matching patient records. Once received by the requesting state's PMP system, they are combined with that state's matching records to create one report view. The hub and the receiving state do not retain the data. Because all PMP data is collected in a format developed by the American Society for Automation in Pharmacy, or ASAP, the data is able to be combined to be interpreted consistently in one report view. It's critical to understand that each state PMP operates separately, according to guidelines and restrictions established by state law. The hubs offer state-level settings and restrictions to ensure that our state's data is only accessed as allowed in our statute, regardless of the home jurisdiction of the user. There are 54 states or jurisdictions that have operational PMPs. Yes, that's more than there are states. This includes Puerto Rico, Mariana Islands, Guam, Washington, D.C., and the Military Health System. For the purposes of this presentation, we will call each of these a state. As I said, permissions are set within the hub to allow or disallow access to a state's PMP record. As a Minnesota PMP authorized account holder, there are several things that may restrict your access to search data in another jurisdiction. Your role type and/or credentials must match what is allowed in the other state. For example, Minnesota allows access to any delegate approved to search by a supervising account holder. Licensed delegates, such as an RN or LPN or a pharmacist technician, as well as unlicensed delegates, such as a medical secretary, reception staff, or medical assistants. Some jurisdictions do not allow unlicensed delegates. This is a setting that the state program administrator can set to restrict or allow these role types. Minnesota retains our reported reports in the PMP for 12 months only. There are some states that retain their records for 24 or 36 months, and some states retain records indefinitely. Regardless of what is available by the state searched, Minnesota account holders can only view 12 months of PMP data from any state. State PMPs vary what drugs are collected and displayed. Minnesota collects gabapentin. Some states do not collect gabapentin, so it would not be reported to that state's PMP or available in an interstate search. States can also customize their PMP reports to include additional data sets, like non-fatal overdose events, incarceration data, and/or drug arrests. Custom alerts or flags are generated based on these events. Since this is not allowed per Minnesota statute, this data would not be shared with a Minnesota PMP user searching that state. Within the Aware web portal, you're able to set which states you search by default. First, log into your Aware account. Simply click your account name in the right corner, select the drop-down for default PMPI states. You can also access these settings through the menu tab. Select any states that you would like to search by default with each Aware search. You can also manually select states for each search or manually deselect states that you've previously selected by default. How does the hub work without compromising data security? As previously mentioned, the interstate data sharing hubs do not retain any transactional data. Statute requires that they act only as a pass-through, carrying the message from one state's database to another. If an authorized account holder in Minnesota performs a search that includes another state, such as Iowa, the user's credentials and the search criteria are sent to the hub. The hub references the controls set by the responding state. If the user is a role type that is allowed per their statute, the hub will continue the request on to Iowa and then return the sealed results back to the Minnesota PMP searcher. If the user is a role type that is not allowed by Iowa, the search will not be performed and the hub will return a message that the search is disallowed. The same would apply to someone in Iowa that selected Minnesota's PMP to be searched. Minnesota's settings would be reviewed, and if the user's credentials are allowed by Minnesota, the hub will pass the request to our state and send back the results. Again, no data is retained in the hub during this process. Because Minnesota does not allow direct access to some role types, such as law enforcement or health system administrator, the controls set by our program are able to stop the request from users in these roles, and the search request will not be delivered to Minnesota. If a user in Minnesota searches Iowa and their role type is unlicensed delegate, the search will be disallowed by the hub because Iowa requires delegate account holders to be licensed. For tracking purposes, reporting tools are available for each program administrator. In Minnesota, the volume of allowed and disallowed searches is reviewed monthly to ensure the controls are working as expected. If you're performing multi-state searches, it's important to understand how patient matching works in the Minnesota PMP and with other states' records. First, we will review patient matching within the Minnesota database only. Each dispensation record is reported with the patient information available to that pharmacy. Different pharmacies may register the same patient differently. We will use Mary Ann as an example patient. Mary Ann visits pharmacy number 1, where she is known as Mary Smith Jones. Pharmacy number 2 may be her mail order pharmacy, and they have her registered as Mary Ann Smith. If we include a third pharmacy for perhaps a prescription upon discharge from a hospital visit, the hospital has Mary Ann registered as Mary, middle initial A, and last name Smith. Each record is sent to the Minnesota PMP once the prescription is handed to or sent to the patient. Our vendor has enabled a patient matching algorithm that looks at multiple patient demographic fields, primarily name, date of birth, and address. As the new records come into the database, if enough fields in each record match, the algorithm will link these patient records together into one group. The result is that anyone searching for Mary Ann using any of these aliases will have the entire group of records return in the report. If the records match enough but are not grouped, the searcher will receive a pick list to select the record or records that they believe to be their patient. If the searcher selects ungrouped records to generate a report, a notice is sent to our program to review and potentially link the records together manually. Now let's look at performing a multi-state search with a common name like Mary Smith. In this example, the Minnesota user will perform a search and select to include Iowa PMP records. If there are records for a Mary Smith that received controlled substances in Iowa, and they have a close or identical date of birth, which does happen, the Interstate Hub will return a report combining both Mary Ann as well as Mary Smith's records from Iowa. The user must use their own knowledge of the patient gained from your discussion or consultation with Mary Ann, as well as other historical records available to determine if they believe Iowa Mary is truly their patient Mary Ann. If you believe that Mary Ann has not been to Iowa to receive treatment, you have two choices. You can disregard the records returned from Iowa and analyze only Mary Ann's Minnesota records, or you can rerun the report and deselect the state of Iowa from your search. The results of this search would group 4 patient records together for the PMP report. Let's take a look at how this appears in a report. There is a section called Report Criteria. This will display the information that was entered by you, the searcher. Above that, in the header of the report, will display the name, date of birth, and address for the record that was most recently reported. You can see the header shows the number of records that matched your search criteria, in this case 4. Please note the banner that appeared with an alert related to this report. In this case, the banner reads, "One or more patients do not exactly match the search patient demographic information that was sent during search. The report is displayed for the next best possible match. Please verify the report is for the intended patient before proceeding." The system is defaulted to return more results rather than less results. Expanding the caret beside the number of linked records will present the record details. Each record is assigned an ID number. In addition to the records with Minnesota addresses, there is one with an Iowa address. This is ID number 4. Our program has the ability to manually deconsolidate records that are linked if they were reported to our Minnesota PMP. However, when interstate records populate in a report, they are not truly linked. They are returned as possible matches based on your search criteria. Scrolling further down the report, you can examine the line-by-line prescription data. Each dispensation reported will show the ID number of the patient record it is attributed to. Additionally, you'll see a column titled PMP. This will show the PMP database that this record was reported to. We can see here that the prescription filled on July 7th for Adderall is attributed to record number 4 for Mary Smith with an Iowa home address. This record was reported to the Iowa PMP. Use your judgment to determine if this record could be for your patient. Rerunning this report and excluding Iowa from the search criteria will show only Minnesota records. These columns can be sorted at any level to group patient records by patient ID, PMP, drug name, dispenser, etc. The default view sorts by fill date, newest to oldest. The program recommends selecting states to search meaningfully, rather than selecting all PMP states available. Specifically for patients with common names, a broad search will increase the risk of false positives generating in the report. More information related to Interstate PMP access is available on our website at mn.gov/boards/pharmacy-PMP/searchers. From the homepage, select PMP Searchers. Then select the tab titled Interstate Searching. You'll see a map showing our currently connected jurisdictions, as well as a link to a reference sheet detailing what roles may be restricted by each state. Please note this view will change with any new connections. The next recommended session is number 5, Integrated One-Click Access to Minnesota PMP Data. Thank you for your participation.